The annual enrollment period runs from October 15th to December 7th. This is the one time per year you can enroll in a Medicare Advantage plan, disenroll from your current Medicare Advantage plan back to original Medicare and pick a Medicare Supplement if you like. You can enroll in Part D, change your Part D plan, or disenroll entirely from Part D. Now, I mentioned Medicare Supplements, and technically the annual enrollment period has nothing to do with Medicare Supplements, but this is the time of year a lot of seniors shop for a new plan, or they shop to lower the rate that they have on their current Medicare Supplement plan. Now, you can actually change your Medicare Supplement anytime during the year. Heck, you can change it every month if you want to. I've never met anyone that wanted to do that, thank goodness. But my point is, the annual enrollment period has nothing to do with Medicare Supplements. But I'll talk more about Medicare Supplements in a little bit. This video will cover all of these options and more. I'm Chris Duncan, and I'm that damn Medicare guy, and I run Trusted Benefits Direct, an independent Medicare insurance agency. I am independent, so I get to represent many different companies and plans, so we can shop together for the exact right company and program for you, and my services, they're not going to cost you a dime. I will answer all of your questions about Medicare in easy to understand terms. If this video helps you, please like and share, or the best is to make a comment. Please subscribe to my YouTube channel and like my Facebook page as well. When you do these things, it really helps me with Facebook, YouTube, Google, and more for people to find me. So what can you do during the annual enrollment period? If you are on original Medicare and are past your initial open enrollment period, you can elect a new Medicare Advantage plan or a new Part D plan. But be careful, this may result in a Part D penalty if you elect a Part D plan or a Medicare Advantage plan with Part D coverage. Best thing to do is to contact me so we can go over your specific situation, because there are a lot of factors determining whether you will get the penalty or not. If you have a Medicare Advantage plan with or without Part D drug coverage, you can disenroll from your Medicare Advantage plan and return back to original Medicare. Most people that disenroll from a Medicare Advantage plan during the annual enrollment period are also looking to put a Medicare Supplement into place. It is important to know, just because you disenroll from a Medicare Advantage plan, that does not mean the Medicare Supplement that you want can be put in place without the insurance company asking you health underwriting questions. In most circumstances, you must answer their health underwriting questions, and the insurance company evaluates your health to make sure you pass their health qualifications. This sounds scarier than it actually is. By working with an independent agent like myself, I know the health questions with each company that they ask in advance and know which companies are favorable to certain health conditions. Quick example is, some companies ask your height and weight, and some others, they don't. Some companies ask you if you take insulin for diabetes, and some don't. Some insurance companies ask you if you've had cancer, heart attack, or a stroke in the last 2 years. Some ask if it's been in the last 5 years, and so on. I get calls all the time where someone will say, I talked to XYZ insurance company and they denied me coverage, or I talked to XYZ independent agency and they said I wouldn't qualify. They also say, I don't think you can help me, but I am desperate. And here's a testimonial from one of my clients in California that found me on the YouTube. This is from Tony J. in Oakdale, California. I will provide a link in the description for this and all my testimonials. And here are the highlights of what Tony said, speaking of agents that he contacted me. He contacted 3 agencies before contacting me, and he said the first agency reviewed his condition and prescription medications and told him not to bother because his medical issues and prescription drugs would result in a denial of application for coverage. The second agent that he talked to, it took his information and sent it to a large Medicare Supplement provider, and within a week, he had received a denial of application from the carrier due to his medical issues and prescribed drugs. The third one, they also took his information and said that they would review his situation with their providers and that they would call him back with the best available options for him. And they never called him back and didn't even receive any callbacks after leaving a couple of voicemails for them. Tony goes on to say, I moved on and kept checking ads and videos on YouTube and came across one posted by Chris Duncan. Chris Duncan, that's me. I'm that damn Medicare guy. He continues, Chris sparked my interest because he spoke about different ways to get approval for a Medicare Supplement provider that I hadn't heard about. At this point, I had nothing to lose, so I completed the short online form at his website, trustedbenefitsdirect.com, and was called by Chris soon afterwards. And this is what happened. He assured me right away that he knew his way around the Medicare insurance underwriting process. And since I was living in California, that there were some other avenues available to get coverage. This was refreshing, and I must admit that I was a little skeptical after 3 previous experiences. And to wrap up this review, Tony says, not only did me deliver as promised, Chris managed to get 2 providers that offered me the Plan G supplement I was wanting at the low rates offered to new Medicare recipients or those without pre-existing conditions and prescriptions. I now have what I was looking for because of his special talents and thorough knowledge of the Medicare industry and the process. He made me feel like my situation was a priority to him and absolutely delivered 100%. I can't thank him enough. He got it done when others said it couldn't happen. I won't waste my time calling other agents in the future because of what Chris delivered successfully. Thank you again, Chris. You're awesome. Tony, I want to say thanks again so much for that wonderful review. And by the way, so you know, I didn't use any guarantee issue tricks for Tony or anything. I just knew all of the underwriting guidelines from all the different companies and found the 2 best companies that were highly likely, in my opinion, to go ahead and get him his Plan G Medicare Supplement issued. And I went ahead and submitted both of those applications to both companies. One had a little higher price than the other company, and both ended up accepting him. And what we did is we went ahead and accepted the price that had, or excuse me, accepted the company with the lower price and went ahead and canceled the other company before it went into effect. Now, Medicare, this is my job and my passion to help people with Medicare get the best possible outcome. It really is the right thing to do to contact a very experienced independent agent. If you have an independent agent, you should be contacting them. But if you don't have an agent or haven't heard from yours in a long time, I would love for you to call me. I would love to apply for the job of becoming your agent. Okay, let's keep going. The annual enrollment period is also the time to change from one Medicare Advantage plan to another Medicare Advantage plan if you wish. It is at least a good idea to shop the different Medicare Advantage plans because they change every year. Most people that contact me are able to find a plan that better suits their needs. They are usually able to find a plan that offers more ancillary benefits like dental, vision, hearing aid coverage, over-the-counter pharmacy benefits, personal emergency response systems, and much more. Most Medicare beneficiaries that call me are able to find a plan with more of these ancillary benefits, but they are also usually able to lower their prescription drug costs. Almost all Medicare Advantage plans also include Part D at no additional premium, but each company has a different formulary. And formulary is just a fancy word for a list of prescriptions that are covered by the plan and at what specific cost. Many times, Medicare beneficiaries don't realize that they can lower their prescription costs quite substantially with a different Medicare Advantage company. We are able to help do this while keeping the same exact doctors, medical groups, hospitals, etc. that you have now. The doctors and medical group you are with now likely contract the exact same way as the company you are with now, as with a different company. We have a list of all the medical groups and doctors and what Medicare Advantage plans they take. We regularly help Medicare beneficiaries like you save money on their prescriptions, add ancillary benefits while not changing any doctors or medical groups. Give me a call and we can compare the plans, benefits, and costs for your prescriptions. Members of one of our most popular Medicare Advantage plans tells us that 90% of the prescriptions their members take are eligible for a $0 copay for their medication. Again, give me a call. By services, they don't cost you a dime, and there is never any obligation or hard selling. When you call these giant call centers located around the country, the agents you talk to, they have sales quotas they need to fill, and managers constantly looking at their sales because they have investors they need to pay. With me, I'm the boss. I don't have sales quotas or any of these pressures. I sell to people the exact way I want to be sold to. I want the facts presented to me in as easy to understand terms as possible, and then when I ask, I want to understand my salesperson's opinion. So I present facts and give my opinions when I'm asked. If you like the high-pressure sales tactics, I'm not the person you should be talking with. But if you want to have a pleasant conversation about all of your options while getting all of the facts to help you make the best possible Medicare decision for your needs, I'm probably a great choice for you. Okay, if you want to disenroll from your Medicare Advantage plan during the annual enrollment period, this is the time to also elect a standalone Part D prescription plan. It is not mandatory, however, it probably is a good idea. Again, when shopping for a Part D plan, it makes sense to use an independent agent because they have access to almost all the Part D plans. Let me tell you how I do it. When you contact me, I will get a list of all of your prescriptions you take. I first run a search through my website, partdnow.com. You can also do this on your own as well through my site, partdnow.com. This site has all the plans that I represent by zip code. This site doesn't have all the Part D plans available, but these are the plans I have chosen to do business with. I don't represent all companies for various reasons. If I don't represent a company, it is either because a specific company doesn't work with independent agents, or usually it is because, in my opinion, they lack in customer service. The first search, though, through my website is very good and gives me the premiums, deductibles, copays, coinsurance, cost during the coverage gap phase, and catastrophic coverage phase as well. Then, to be sure I am thorough, I also run the prescriptions through Medicare's website directly. What I'm looking for here is if any of the companies I don't represent offer significantly lower premium, copays, etc. as compared to the companies I represent. I then report all of my findings to my client or prospective client and let them decide. Sometimes there are significant savings using one of the companies I don't represent. This means I don't get paid, and that's okay. And I will suggest to the client to get the program I don't represent. I'm here to do what is right for you, my clients, and my prospective clients as well. Now, if you have a Part D plan, this is the one time during the year you can move from one company to another company. With Part D drug plans, there are never any underwriting rules. The only qualifications to get a Part D plan is you need Part A and or Part B of Medicare, and you live in the service area of the plan. The service area for Part D plans they're statewide. Medicare Advantage plans generally have a service areas by county, but they can also be as specific as zip codes in a certain county. However, the Part D plans, they are offered by state. If you would like to shop your Medicare Part D plan, you can start through my website, partdnow.com. Again, not all companies are on my website, only the companies I want to do business with. If you'd like to view all the programs available, you can go directly to Medicare's website. Please feel free to contact me with any questions. During the AEP, if you like, you can also totally disenroll from your Part D plan. Remember, Part D is optional. You don't have to have a Part D plan. However, if you disenroll from a Part D plan after your initial enrollment period and would like to re-enroll outside of the annual enrollment period, you will not be able to do that unless you have a special enrollment period. There is a list of these, and I've covered them in other videos and don't want to take up time here for this right now. If you do disenroll from the Part D and then do re-enroll at a later date, you will likely incur a Part D monthly penalty. Again, I have other videos about the Part D enrollment penalty. People tell me, Chris, I don't take prescriptions, so why do I need a Part D plan? I tell them, well, they probably don't need a Part D plan, but a way to think about Part D is like your home and auto insurance. It is likely our home isn't on fire right now, and it is unlikely we will have an auto accident in the very near future, but we have those coverages in place. You may want to look at Part D in the same way. You may not be taking prescriptions right now, but as we get older, the likelihood of our health changing rapidly it increases quite significantly. I have known, and it is likely you have known someone that has been healthy and has been diagnosed with a disease like cancer, maybe had a heart attack or stroke unexpectedly out of nowhere. There are plans in many parts of the country that cost less than $20 a month. Whether you get a Part D plan or not is entirely up to you. I will finish with changing Medicare Supplement companies. Like I said, this has nothing to do with the annual enrollment period, but a lot of seniors think it does. The biggest misconception I see is seniors believe this is the one time during the year they can lower their premium and not answer any medical questions. I wish this was true, but it simply isn't the case. If you want to lower your premium, you will likely have to go through medical underwriting. Now, some states like California, Oregon, Missouri, Washington, New York, Connecticut, Massachusetts, Maine have a special provision for guarantee issue, but in every other state, if you want to switch your Medicare Supplement company, you will likely have to go through underwriting. There are some other special circumstances, and I don't want to go through those here as this video is already running long, but if you want more help, it is easy to contact me and ask any questions that you have. As you probably know, Medicare supplements, they're standardized, meaning the letter plan you have now, Medicare dictates that every other company that offers that plan with the same letter must have the same benefits. There are only a couple of things that are different. One is the premium that you pay. Second is if a specific company offers any extra benefits. Some Medicare supplement companies are now offering gym memberships, vision insurance, hearing insurance, and more inside of their Medicare supplement plans. And if you change your Medicare supplement company to save money, likely the only thing that will be different is you pay a lower premium and the logo on your insurance card that you give to the doctor at the doctor's office. Because Medicare supplements, they actually supplement original Medicare. There are no doctor networks. So you know whatever provider you see now that is accepting your Medicare supplement, that you will also have the same coverage and continue to see the same doctors, hospitals, and providers that you see now. Like I said, the most likely difference is you will save money and have a different insurance card to give to your doctor. Again, being an independent agent gives me that access to almost all the companies that sell Medicare supplements. Now again, I don't represent all of the companies. There are some companies I refuse to represent, usually because I have had too many clients having bad experiences, and I've had bad experiences with those companies as well. Some companies, they just simply don't have a good reputation when it comes to rate increases. I generally shy away from smaller companies that are new to the Medicare space. Usually these companies will come into the market and try to provide an extremely low rate in the beginning to get business, only to see them jack up the rates later. And that isn't a good experience for you or for me and my clients. I try to work with the most well-known companies that are the most stable. Almost all of my clients are on a fixed income, and saving money is extremely important. However, getting a Medicare supplement just because it has the lowest rate today isn't the best practice for you usually, only to see the rate go sky high in a few months or a year or a year or two later. We take the time to vet all the companies we represent and have found in general the big name brand name companies you already know to usually have the best practices. To shop your Medicare supplement rate, it's easy. You can call me, or if you just want to poke around a little, you can actually go directly to my website, MedicareRateQuote.com. There you will actually be able to look at the different rates available for whatever plan you're looking for. Every other source I found online actually plays tricks with you to get you to enter in your information. The reason they do this is they are trying to sell your information to other agents and insurance companies. They make it look like they will show you the rates, and after you put in your valuable information, only to say, "Thanks for your information," an agent, they'll be contacting you shortly. I don't do that. If you've watched this video this long or other videos that I have, I believe you have a pretty good sense I'm a no-nonsense guy, and I don't have time to do business like that. You'll be able to see the available rates without any shenanigans. This is all I have for this video. Thank you so much for watching all of my video. Again, I'm Chris Duncan, that damn Medicare guy. Depending on where you are watching this video, you can contact me by clicking the button to fill out your info in our secure contact form, or best yet, and if there isn't a button, simply call me at 800-910-3382. And unlike anything else you fill out online, only I'm going to contact you. Almost everything else you see online is a data gathering trick where they will sell your data to dozens of insurance agents and insurance companies, and you're flooded with phone calls. You know what I mean if you've already done that. You can rest easy that I'll be the only one contacting you, and you'll be on your way to getting the best program for your needs. Please don't forget to subscribe to my Facebook page and YouTube channel to get immediate updates when I do new important videos. Also, please help me by liking and commenting on my videos. It helps me greatly. Thanks again. Hope to be talking with you soon.